At the Advocate Children's Hospital Park Ridge NICU, we provide the highest level of neonatal care to a wide range of complex patients with extreme prematurity, respiratory disorders, and with life-threatening congenital anomalies. Our NICU is a fully equipped 54-bed unit with a dedicated world-class 8-bed micropreemie unit located within the unit. We have several highly specialized programs within the NICU. Our neonatology team leads an ECMO Center of Excellence in which our neonatal perinatal medicine fellows actively participate, giving them the opportunity to become ECMO certified during their fellowship. And we also have a high-risk delivery service for patients cared for in our Center for Fetal Care program. Because of our vast array of services, our fellows can follow the patient through the entire continuum of care. We offer one of the finest clinical training programs in the country for training our neonatal perinatal fellows, with a broad range of clinical, teaching, research, and leadership opportunities utilizing the latest and cutting-edge technology and evidence-based medicine.
Our program is fortunate to have a state-of-the-art simulation center. As fellows, we participate in a variety of simulations, including NICU and ECMO sims. We also join attendings for biannual NICU task training to learn and review complex procedural skills such as chest tubes, exchange transfusions, abdominal centesis, pericardiocentesis, and others. The Simulation Center staff also help plan and execute neonatal mock codes that take place in the NICU. Fellows are an important part of the mock codes, both as learners and as teachers for the pediatric residents. In addition to this, we also attend the Midwest Neonatal Simulation Bootcamp yearly, where we not only get to hone our procedural skills, but also network with the other fellows.
Our fellowship program is dedicated to fostering fellows' growth in research and QI initiatives. They explore topics of interest through regular meetings with mentors and dedicated research team. They are guided every step of the way, from developing research ideas to navigating IRB, data collection and analysis, and finally manuscript submission. We encourage collaborative projects with researchers in affiliated institutions, which enhances their research experience. Our NICU is also very committed to comprehensive follow-up care for infants at risk of developmental challenges. Our follow-up clinic, which is staffed by a multidisciplinary team, closely monitors infants' development for 2 to 3 years following discharge.
We have scheduled didactic sessions almost daily throughout the week. And we as a fellow have projected time for the educational activities. We have monthly journal club and research meeting. And bi-weekly, we also have this Fetal Care Center conference in conjunction with the MFM group to go over some of the high-risk deliveries and cases. We have board review session with the neonatologists to go over some of the high-yield topics and also practice some of the questions.
So one of the great things about living in Park Ridge, where Advocate Lutheran is at, is that it is in a suburb. So you are close enough to the city, however, of Chicago, that you are able to go live in the city if you want. Some of the fellows have lived in the city in the past, but you can also live in the suburbs. There's a lot of restaurants in Park Ridge and the surrounding area without going into the city. There's a lot less traffic, and there's also a lot of daycares and things like that in the area for those of you who have children.
We aim for at least one golden weekend per month. We also have a very informal process for trading calls between the fellows. We have a call cap over the 3 years of training. Any extra calls are expected to be covered by the attendings.
We have a good balance of working really hard and enjoying some recreational activities outside of work. So far, I think from bowling, top golf, various dinners, softball tournaments within the unit, and medieval times, my favorite activity thus far has probably been top golf. I'm not actually a golfer, but I did enjoy the experience and trying something new.
The Heart Center is one of the highest volume programs in the nation with 449 cardiac surgeries, 525 cardiac catheterizations that are performed annually. Fellows will get diverse exposure to a variety of congenital heart disease, from simple septal defects to complex single ventricle. Fellows are involved in all of the stages of care, from prenatal consultation, coordinated planned deliveries, and through surgical repair.
I think that the program offers a great clinical experience with a wide variety of pathology and different modalities of treatment, including ECMO.
A Center for Fetal Care is one of the 2 unique facilities in Illinois offering the whole gamut of in utero fetal therapy. This one-stop shop offers diagnostic procedures, amniocentesis, CVSs, echocardiograms, where we can establish the diagnosis affecting our complex parents. Our neonatology fellows participate in these multidisciplinary discussions for these complex fetal anomalies, allowing patients to better understand the nature of this high-risk complex pregnancy. This also allows for us to work with complex moms that require in utero fetal surgery, such as twin-to-twin transfusion, PUBs, fetal shunt procedures, and open fetal spina bifida as well as exit procedures.
As part of Advocate Healthcare, you're going to be joining a large healthcare organization that reaches out to many patients and families. Specifically, as part of pediatrics, you'll be part of the larger Chicagoland Children's Health Alliance. That's our affiliation with Endeavor Health and the University of Chicago Medicine. And with that, you'll be joining an organization that has over 800 inpatient beds and over 5,000 transports in the last year.
Thank you for your interest in our program. As you can see, we provide a well-balanced neonatal perinatal training here in our program. We aim to produce compassionate neonatologists who have strong clinical and procedural skills, well-versed in research methodology, good with communication skills, and who are lifelong learners. We look forward to meeting you and sharing more about our program. Thank you.